Filling the holes in Virginia's mental health system is a top priority for lawmakers this session.
Since the attack on Senator Creed Deeds and his son's suicide, the response in Richmond has been similar to right after the Virginia Tech shootings. The question this time around, will they be able to fix the system for the long haul? 10 on your side, Stephanie Harris went to the Capitol to find out. Stephanie?
Nicole, Tom, since the Deeds attack, lawmakers have introduced at least 60 bills. Now, one reason for that high number, there are just so many problems plaguing Virginia's mental health system. Health experts say many with mental illness end up in jail, homeless, or dead because of a lack of funding and resources.
1, 2, 3.
They represent the 300,000 Virginians living with severe mental illness.
Perfect.
This group from Virginia Beach has come to Richmond to convince legislators of the need for reform.
And you have to help other members help them.
Their message? Look at us. Mental illness can be treated.
At Beach House.
Know about Beach House.
I'd probably be dead right now about Beach House.
They say we need more places like Beach House, so we decided to check it out.
As you can see, there's no cigarette butts on the ground. So my job is to make sure there's no cigarette butts, no trash, no debris.
Daniel Knight proudly showed us around the place, which is a rehabilitation day program in Virginia Beach. They're called members, not patients here. They learn life skills, running a kitchen, a thrift shop, and putting out a daily newsletter.
I'm glad to be here. I'm glad that I don't have to beat the streets. I'm glad that I don't have to do street life.
Daniel was in and out of the hospital for 16 years before he landed at Beach House. Here, recovery is a team approach among counselors, doctors, and peers.
I'm getting better and better and better.
Daniel could not put a price on what he's found here, but experts say the state should. Medicaid pays $75 a day for members to attend Beach House. It costs more than $600 a day for a hospital bed. The National Alliance on Mental Illness also advocates for Medicaid expansion. NAMI reports that 80% of people with mental illness could get services if that happens. Currently, they say only 19% of adults who need it get state services.
That is something that our state system is charged with doing.
NAMI Virginia Executive Director Mira Signer says the state must be held accountable. Governor Bob McDonnell pledged $38 million in December to expand mental health programs. I ask, is that enough?
It is kind of the, $64,000 question, and I don't think we really know.
Signer says money isn't going to solve all the problems.
To just say that there's X amount of dollars that we want to throw at the problem, I don't think that that's necessarily the approach.
And lawmakers know it.
We've known for a while that our mental health capacities need to be improved.
Delegate Ron Villanueva, Virginia Beach, told me he believes this is the year lawmakers will make it happen. I asked him, how?
Well, you have to trust in the committee process, number one. These bills have been assigned to several areas. One is the mental health subcommittee.
It seems no one knows exactly what it'll take, but this Beach House alum has some ideas.
What we need is education for people with mental illness, their families, for people in the community who do live with the stigma that all people with mental health are dangerous or violent people.
Don Ayers says we have to start in schools with young people. Teach them the violence we see with Gus Deeds and the Newtown school shooter are rare. Mental illness, like diabetes, can be managed, and patients like him and Daniel can live productive, happy lives. All they need.
We need people to care.
Earlier this week, the Senate approved Creed Deeds' bill, which would extend the emergency custody order to 24 hours, create an online registry of available beds, and require a state facility to accept a patient if no bed is found within 8 hours. Now, many of the 60 bills out there propose similar changes. You can take a look at them online. Just go to wavy.com. Stephanie Harris, 10 on your side.